Hello everyone, Melton Schecksnyder here with EraseYourBackPain.com, and I'd like to welcome you to video 2 in our series on sciatica and back pain relief secrets. In our discussion today, we're going to talk about the first condition in our 4-part series on classifications of back pain. And this is a condition I refer to as forward pelvis syndrome. The characteristics of forward pelvis syndrome include a forwardly rotated pelvis, an accentuation of the lumbar curve. So you see here that the lumbar curve here would be more accentuated, or a sway back as you'll sometimes hear it called. Weak abdominal muscles, tight hip flexors here on the front side of the hip, and weak hip extensors, including the buttocks muscle and the hamstrings. The muscle we're going to target today is a muscle that is referred to as the psoas. Now the psoas runs from the upper portion of the lumbar spine and travels through the pelvis to attach to the front side of the hip. And this is it here. As you can see, it runs from this portion of the low back or the lumbar spine, travels down through the pelvis and attaches here to the hip. The psoas functions to flex the hip or bring the knee towards the chest and to extend the spine or bend the spine backwards. I personally consider the psoas to be one of the most overlooked muscles in back pain dysfunction. And the reason I say that is because of all the patients with back pain or sciatica I've seen over the years, the majority of them have had a symptomatic psoas, meaning that it was tender to touch and it was very, very tight. This has led me to conclude that the psoas is one of the primary causes of back pain, and if you can treat the psoas successfully, you'll be effective at treating the back pain. Now, to effectively treat the psoas, what I will do is utilize a two-step approach in my treatment methodology. Step 1 is to vascularize the muscle or bring more blood flow to the muscle. And the way that I do that is through a couple of different exercises. So if you take a look at this particular exercise here, this is the simplest of the two exercises that I'll use. And basically it's just simply sitting on a chair or the side of your bed, putting an ankle weight, light ankle weight at the end of your thigh, just above the knee here, and then just lifting the knee toward the ceiling. And that basically will cause the hip to flex, which will engage the psoas. Do that about 25 times just to get enough blood flow to the muscle to warm it up. Now, another exercise that I will use on people that are a little bit more coordinated is one that is a little bit more specific to the psoas, and it's a combination of trunk rotation and hip flexion. So in this case, what we'll do is we will put an ankle weight at the right around the ankle, light ankle weight, and we'll have the person basically flex the hip, bringing the knee towards the opposite shoulder while at the same time twisting the trunk to the right in this case. So in this case, we're going to be vascularizing the right psoas. Like I said, this is for someone who has a little bit more balance and is a little bit more coordinated, because it is a rather difficult exercise. So the next thing we're going to do is once we have the muscle well vascularized, we're going to do a stretch to the muscle. And there are two stretches that I like to prescribe based on the patient's ability to perform the activity. Exercise number 1, stretch number 1 that is a very simple stretch. What you're going to do is you're going to bring the opposite knee toward your chest, and you're just going to let that hip hang off the side of your bed. That's probably the easiest place to perform the exercise. And by doing that, you're isolating this, in this case, the left hip flexor, and just hold it there for about 20 to 30 seconds. come back out of it by bringing the knee back up to the chest and then letting it hang again to stretch it again. That's the just a very general hip flexor stretch. A more specific stretch to the psoas, however, is the kneeling psoas stretch. And this stretch is you're going to need to perform it in several different steps. So number one is you're going to get into this kneeling position and make sure that your body is directly over the knee that is contacting the floor. The next thing you're going to do is you're going to bring this foot to the outside. Now you can't see it really in the picture here, but what we want is for you to bring the foot to where it's outside the alignment of behind the thigh here. So we don't want it directly behind the thigh. We want it a little to the outside of the thigh. And that's going to rotate the hip inwardly. And from this position here, what we're going to ask you to do is to do a posterior pelvic tilt, or we're going to have you attempt to bring your pelvic bone up and backwards. So kind of like doing a little pelvic thrust of sorts. And then once you get it into that position, you're going to hold it there by squeezing this butt muscle, the buttocks muscle on this side. And then from that position, you're all set up. And most people, when you get into that position, will actually feel a stretch right in this area here. But to fine tune it and to get a little bit more stretch, what we're going to ask you to do is to basically just translate forward, not lean forward or lean backwards. We're just going to have you move forward to where you're just sliding forward this way, okay? And as you do that, that will increase the stretch. And then as a one fine-tuning technique to do, you're going to lean the opposite way. So in this case, he's going to lean to his left. And those are the two stretches that we will typically prescribe to our patients with tight hip flexors. So in summary, what we see is that forward pelvis syndrome is a very common cause of low back pain. And the key to success in treating forward pelvis syndrome is by isolating the psoas and vascularizing it first, followed by a very specific stretch to the muscle. And in doing this consistently, your back pain can be gone sometimes in a matter of hours. I'd like to thank you for joining me today. Tomorrow we'll talk about the second reason people experience back pain, and I'll show you a few more exercises you might find helpful. Until then, this is Malton Schexnayder wishing you good health and reminding you to check out the Erase Your Back Pain blog at the address you see below. We'll talk to you tomorrow.